We'll start with the invocation. Sean, would you mind leading us?
Yes, ma'am. Thank you. Father, just want to come to you today, and as always, Father, thank you for letting us get out of bed this beautiful day you've blessed us with. Like the old song, this is the day the Lord hath made. Everything may not go how we want it to, or how we it might go how we want it to, but we just want to be careful to thank you for every day just like this one you've given us. Help us go now as we do the business of the Cherokee people. Just as always, keep our hearts and minds and mouths in the right place. We'll be sure to thank you for everything. Most of all, thank you for Jesus. In Jesus' name, amen.
Amen.
You want to start with the roll call?
Yes, ma'am. And once again, newly elected, I'll need to know if you want to be a member of the committee. Mary Baker Shaw, present.
Yes.
Mike Dobbins,
Here, yes.
Yul England,
Ani, and yes.
Keith Austin,
Here.
Harley Buzzard,
Here. Yes.
Joe Bird,
Ani, yes.
Sean Crittenden,
Amen.
Frankie Hargis,
Present. Yes.
Wanda Hatfield,
Ahani, yes.
Rex Jordan,
Here.
Dick Light,
Ani.
Mike Shambaugh,
Here, yes.
Leo Smith,
Here, yes.
Janice Taylor,
Here. Yes.
Victoria Vasquez,
Ahani, yes.
David Walkingstick, Brian Warner.
Amen.
Hey,
We
Shug,
do have a quorum.
do we have to see, is it just for the new council members or the existing members?
All the ones involved in an election.
Okay.
We do have a quorum.
Okay, thank you. Right now, has everybody had a chance to look at the minutes?
Move for their approval.
Second. We've had a motion to move and second. All those in favor say aye.
Aye.
Okay, and now we're ready. First off, before we start reports, I'd like to say I'm really honored to be sitting here today as chair of this committee. And I want to thank, from the bottom of my heart, Frankie. She has done an amazing job the last 4 years, and I know I'm going to be calling you many times for advice and suggestions. As a matter of fact, I hope I have the opportunity to talk with each one of our counselors here today to see what area you all see and needs for our health care that you'd like to see us go in that direction. And I hope Dr. Dobbins will go with me in doing that. But I'd like to meet with each one of you individually. But Frankie, I promise I'm going to be calling you a lot, and I congratulate you for the last 4 years. And I think we all owe her a big hand. And we're going to start with our reports. The Claremore Service Unit, Mr. George Valdey.
Good afternoon. I think you have my written report. A couple of things I want to point out. We've been working on the emergency room, working on trying to get it remodeled. It's been awarded to a contractor, and that contractor's up doing site visits this week. They were actually there yesterday talking about the design and build. Surgery clinic remodel is almost completed. They're working on, they're finished down the hallway there where the exam rooms are. The last thing to do is finish the appointment clerk window right there where the two halls intersect. Make it a lot more convenient for patients. 2 weeks ago, we had an air handler over the emergency room, went out. It was an old one. It had been installed. It was about 20 years old. We got it, the facilities guys put it back together and got it. We have it running. We're maintaining temperature and humidity there in the emergency room, but we've already started the acquisition process to replace that air handler and put a larger unit up on the roof, so we don't have to bother with that again. I wanted to brag a little bit. We had 2 nurses selected to the list of Oklahoma Great 100 Nurses, Amy Cantwell and Stephanie Porter, and I'd also like to, Connie Davis was on that list too, so I'd like to congratulate her. That's quite an honor. Dr. Kara Thompson, our Chief of Women's Health, presented at the Focus on American Indian Alaska Native Women Conference, which is sponsored by ACOG. The Claremore Dental Clinic was recommended to be part of a national expanded function dental assistance study on the effectiveness of the existing periodontal program. Our facilities has met with our audiologist to look at, we are purchasing a new audiology booth. We think our audiology program is kind of like yours. It's just completely overrun with patients. We've got folks, I think we're scheduled out already into 2018. So big demand for that. So we're replacing that booth for her. And then lastly, I wanted to give a thank you to the Cherokee Nation Behavioral Health Group. We had an RN pass suddenly. She was in an accident, and the response team came up and spent several days there at the hospital with fellow employees. Did a great job. That was well received, and I wanted to thank them for their hard work and response and coming up and taking care of our employees there. So thank you.
Good.
Questions?
Anyone with any questions? I have one. You were talking about the air conditioning unit that did I understand it malfunctioned or has it gone out?
Yes. Those old it goes. Yes, it went out. We got it going again, and it's running back. It's actually running at full capacity. To assist with that until we can get the new air handler brought in, we're actually ordering some portable air conditioner units to set up there in the emergency room, keep the temperature down and especially the humidity down.
Am I mistaken that the temperature in an emergency room should be at 68 degrees to prevent the growth of bacteria?
We try to keep it below 70. That's our target, is below 70, and the humidity below 60%. Yes.
And so, but we're getting there, right?
Yes.
Okay, very good. Oh, I'm sorry, Counselor Lay. Did you have a question? Yes, sir.
Thank you, Madam Chair. George, there's an IHS meeting in Tucson this week. Do you have anything to do with that, or know what they're making recommendations or decisions? Or one of the things I get to is a question Harley and I always have about the Buell and I have about the folks who need bone surgery, especially hip surgery, are we still going to Oklahoma City? Or?
Yes.
Okay.
Yes, they are. But first part of your question, no, I don't have anything to do with that meeting. But yes, they're still going to Oklahoma City. My proposal, our proposal from Claremore is still, I've talked to the director over at Claremore Hillcrest, and I'm told that our proposal is still sitting in their legal departments. So I keep getting the same answer.
Okay. And the IHS meeting, what do you even know? Do we know what?
I do not see it, no.
Thank you, ma'am. Thank you.
And yes.
Yes,
Mr. President.
George, can you email me the name of the person that's holding this contract up, or
Sure.
who I should write a letter to? Because we have some patients that don't want to go to Oklahoma City, and I would write a letter as me as the tribal council member that represents citizens that is causing a hardship for us. So email me that. It's harley-buzzard@cherokee.org, and I'll write a letter myself. Try to get this thing. I'll send it to all of us if you want. If everybody'd write a letter, that might help. I certainly would like to write a letter.
Be glad to.
The other thing, on the reports, George, I like to look at numbers, and not that I can understand a lot of them, but I wish on the ambulatory or the outpatient visits, can you do a total of what you did per year? You show it by month, but I like to have a cumulative total.
Absolutely.
Yeah, just change that up a little bit. Make it a little easier for me to understand what we're doing there on a yearly basis too. It's on this first page. It's say outpatients visits up, and you're showing how many for that month.
Yes.
Doing a cumulative
I'll be glad
total
to.
on that.
You bet.
Okay, thank you, Madam Chair.
Any other questions? Mr. Valerie, thank you
Thank
so
you.
much for coming in. I appreciate it. And next, we'll have our report from Connie Davis.
Good afternoon. Just going to highlight a few things from our report. Something you'll see at the front of the report, we frequently, believe it or not, get emails, cards, letters of commendation for the services that patients have received, recognizing employees have gone above and beyond. And I think that's a big part of our report that we don't always share with you. So I've asked Sohail, Dr. Khan, to start including some of those comments in the report so you can see where people are going above and beyond. Because I know you, as well as we, appreciate hearing the good things that happen, not only the things that are challenging to our citizens. So a few of those are in the front of the report. As you can see, in June, we continue to stay very, very busy in our health centers. 10,061 patients in Willoughby were seen at Wellman P. Mankiller. Redbird Smith saw 10,644. Salina, 8,205. J, 7,134. Nowata, 4,970. And I believe that was with the clinic down one day, unless I'm getting my months. We had power loss one day, if I remember, Councilman right. Three Rivers, 15,642 patients. I remember when that number was 10. Oshaleta, 4,397. Bonita, 9,343. Gadugi Clinic, 305. And Hastings, 34,621. That's a lot of people in 1 month. The following pages kind of give some yearly comparisons for volume, and you can see we're up just a little bit from last year for the month of June, but significantly over 2015. The trends in dental services, clinic visits are just off the chart there, and I believe that's because appointments are being made and there's fewer emergency visits needed because people can get an appointment when being asked. The emergency room at Hastings saw 6,005 patients and had a left without being seen rate of, I believe it was 2.6%. Dr. Khan has rounded that up to 3%. Again, for the new members of this committee, that is the national trend. When we first started this effort, we were at 10% of our patients leaving without being seen, and we have new leadership in that emergency room under Dr. Katie Hughes, and then Dr. Sharon Smallwood as medical director of the hospital, and they're really pushing to improve the processes, so we're very happy with that. Set another record number of surgical procedures for June, 474. Finally, our third-party revenue is headed the right direction and consistently. This is something those of you who've been with us for the last couple of years have known we've struggled, and we are finally leveling out. We had our report, I believe, Monday morning for last week was a collection of $3.3 million, and it's pretty consistently hovering around that mark. We will make budget this year. Yay. Thank God. And thank Mitch and Amy and Rick and a whole lot of coders and billers. And you can see the comparisons on page, I've got 2 page numbers, 9 and 14 in the Health Committee report. Our contract health spending is still over budget, but we're hoping to continue to tighten up those expenditures up as best we can, but not compromise services at the same time. The usual diagnosis that we're seeing in our clinics is attached. Type 2 diabetes and hypertension always leads the way. And the good thing is we manage those patients very well. I think and I apologize, was crammed busy this morning and didn't get to read and refresh my mind. I do want to thank the Marshal Service publicly for helping us out. We had a little incident at the Bonita Health Center last week and needed the Marshal's support, and we appreciate them helping us with that. I'm going to pass around the most current recruitment report for your review. What this has is the total number of budgeted providers for your facility, so you become familiar with those, and then there's a guide at the bottom if you have questions.
Is there one?
Oh, Dr. Stallcup was out recruiting this morning. Did you do anything good today?
Does anyone have any questions? Yes. Ms. Vasquez.
Ms. Taylor.
Ms. Taylor, excuse me.
I just had a comment. I was at an event a couple of weeks ago, and Amy Estes spoke to the group. She is a nurse midwife at Hastings and loves her job, and just couldn't say enough good things about the work that she does and about working there. And you could tell she was very passionate for what she's doing. And if all of our healthcare providers were as passionate about their job and the people they serve as she is, we're doing something right. So I just wanted to tell you that.
Thank you.
Mhm.
Hey Connie, first I thank you for helping me out in that situation. I brought the
Sure.
guy in and you helped him, and also Dr. Stallcup. I appreciate sending the email and you guys getting back with me. So you've really helped me that way. But I burnt my big old belly the other day, and I went to Wilma Pete, and I seen there was these little white signs pasted there where none of us like, but no drop-in doctor today. And are we still headed that direction to try and get 2 per day, 2 drop-in doctors per day? I mean, that's the recruitment plan.
I think we're budgeted for, well, we're fully staffed there, so when the person assigned to do drop-ins is out, then that is a problem, but we try to go ahead and get them seen in primary care clinic to take up that slack.
Now, when that particular day, there was one scheduled, but on vacation, and of course they were gone. And the next week, I talked to someone, and that was going to be the same scenario. But do we have anything as far as covering those doctors, or just?
I think in the future we can do a little bit better planning and maybe have someone, a resident cover drop-ins. They provide a lot of benefit to us, the family practice residents from OSU, and I think we can do a little better planning to prevent that from happening again.
Thank you. Thank you.
Counselor Lay, did you have a question?
Yes, ma'am, thank you. The provider pay rate, where is that in the process or system at this point?
We have met and met and met and re-met, and I believe we have come to both, all of us being administration, health services, running it through the finances and treasurer's office, and I think we have a good plan to put forward to you guys very soon. Like within, where's Chuck? Secretary left. I would expect them by the next budget, maybe by budget hearings. I'm speculating, but I'm kind of thinking that's the plan.
So this would be 2018 or?
this year. 2018 budget, yes, sir.
On the 2018 budget?
I hope so, yes.
And so that will be November, December before they kick in?
Our hopes are that the contracts are put forward effective October 1 with the same fiscal year.
And so will you provide new contracts then, or what, for every provider?
Yes. Which we do that, you know, I think most of them are on 2-year contracts, so we're accustomed to rewriting contracts frequently and meeting with the docs and going over those.
So they'll all restart in October 1?
Yes, sir.
So normally the contracts, I think, are from when they come in, or?
They've
So that
changed,
we'll generate all new contracts? October?
yes, yes.
And so is this past the executive branch yet, or have we
I'm
got
waiting.
blessed, or?
We're waiting for final approval, and it just went chief's office, I believe, on late Friday. Is that right, Dr. Stalkup?
Yes, ma'am, we actually have HR finalizing one last review on it, and then it's going to go to the chief's office, so it should be within the next couple of days.
So it's not at the chief's office yet, or?
No, sir, it will be, Nason wanted to take one last look at it and meet with his staff, and then it will be sent over. We've already got the packets all prepared.
Nason, at HR.
Yes, sir.
I apologize, I thought his staffers and everyone had completed that. That was my misunderstanding.
When can you release the information, or give us the good news, or what?
I believe as soon as Nason has the opportunity to finalize his blessing, the chief's office will release
And then
that.
you're coming back through budget hearings or ENF?
I haven't been directed on how that will be presented.
I'm clueless. So, I mean, I would think if she's got it ready in 18 budget, I don't see why we can't just do it in budget hearings. I don't know that we need to do.
And I don't want
I
to
mean,
speak
it's
out of line, I don't know for sure how that's planned, but I anticipate that we can offer new contracts beginning this fiscal year.
And is the speaker, you looked for him just a second ago, is he the person that I need to ask that question of then, or?
Secretary,
Specifically, excuse me, the secretary?
that, I was looking for him because I saw him here, so, oh,
He's out there. He's texting.
Paul texted me the answer and I don't take my phone here. I bet I can ask and then we can get an email out to you guys.
I think he's coming back in.
May I just do a timeout and when he comes back? He's on his way.
He's in now.
I do have a question since we're talking about contracts. I had a phone call just recently, and they were telling me that they had some concern that the new contracts are open-ended on a physician, and that it's going to state that any physician or provider at our institutions here can be terminated without reason with a 30-day notice. Is that correct?
That's how the contracts are right now. They've been that way for the last 4 years.
Do we not find that as somewhat harmful in our recruitment efforts?
We have not had to exercise that.
Ever? We've never exercised. Well, I feel so much better. Is it possible that we could reword that just to be a little kinder to make it more attractive for recruitment purposes?
I don't believe that clause has any impact on recruitment. Professionally, most contracts that are issued even in the private sector do have a no-fault contract non-renewal. It has to do with a lot of technicalities on what happens with physician employment. I don't think it's harmful to us to have that in there. I think that it's probably immaterial to the people who are being recruited for it.
It's immaterial, but we've never acted upon it, so I feel better about that then. Thank you. Councilor Buzzer, did you have a question?
Yes, I did.
Oh, I'm sorry. I'm sorry. Let's go back. Councilor Lay, let you
Thank you.
finish.
And, okay, so Secretary, we're talking about the pay raise, and I have 2 questions. When does it become available? And is it the base pay?
The plan is an adjustment to base and implementation of the RVU, which is essentially the pay per performance that has been outlined previously. And the idea is to go forward in FY18 with that. So our budget will support that.
Are we running through budget so it'll become available October 1, or?
I don't know if the implementation date's October 1, but we're prepared in FY18 to implement it, so we can get back to you on the more precise date if it's not October 1, but we'll certainly do that, Madam Chair.
And if we, so it hasn't been approved yet through the executive branch.
Still reviewing it, but we've been discussing it at some detail and very encouraged by what we got from Health. So they've been very responsive to the committee.
Davis says we'll bring it back through this body, is that correct, or?
I fully anticipate at some point we will present what is going to happen with compensation, because the last presentation was focused on the RVU, so I think we certainly want to come back and tell you what's going to happen on base. But in terms of implementing that, we need a budget to implement it, and as we do with any pay adjustment, and so the budget that we get from the council through budget hearings will support that.
When do you anticipate bringing it for us to let us know?
That we'll have to report back to you, but I would imagine soon after the budget's approved, we'll outline how that's being implemented. But we can get back to you.
So we're going to go through the budget process first and then hear about the pay raise?
Well, I think any program, including health, including compensation, is fair game for a budget hearing, and so there may be some discussion at the budget hearing, but I know that we will outline how it will be implemented very shortly. But we're still working on our end to finalize that. We're just not prepared at this moment to roll it out.
Thank you.
Councilor Buster?
Yes, Connie, I have a couple of things that I want to discuss with you. But first of all, let me go back to the old clinic. And Jay, I hope and I know you've had a lot on the table recently, but I hope there's more discussion about doing something at that building up there, the old Jay Clinic.
Yes.
Drove by the other day and the grass is about that tall again, so hopefully they get it mowed. But it just looks like it's deteriorating because we're not in there. I brought up the last time, about using it for purposes of mental health services or a treatment center or something like that, but I hope there's some ongoing discussion about it, and I'd be glad to sit in on some of those discussions, what I've heard and what people would like to see up there. The other thing is, and I didn't understand this patient that called me, said there was some changes in cataract surgery referrals out of eye clinic. Are you aware of anything as far as contract health, or we're not doing cataract surgeries? Or if you don't mind, check into that and see if there's been any changes on contract health for eye cataract removals. The other thing is in the surgery clinic, podiatry. Do we have a surgeon there that works podiatrist?
We have two surgical podiatrists.
Okay, are they doing those? I'm hearing they're not doing any of those.
So we have cut back some
Okay, that's what
on
I've
those
heard.
services.
Why are we cutting back?
The contract health budget is.
Okay, and that's what I've heard
Yeah.
too. So we anticipate getting this fixed hopefully on the next budget hearing.
We do. They're very, very, very expensive surgeries.
Okay.
A lot of the equipment and devices, implants to use on those patients. I mean, it's important, and I use those services, but boy, it's expensive.
Okay. Well, that's, and I said I would find out and ask the question, so, okay, so it's part of the contract dollars that's in there that's being used by this time of the year, and it's understandable,
Yeah.
the thing at the end of the year. The other thing is, and I don't know, it's probably, should address it more to Brett Hayes, but I have got a couple of people that just keep calling me because either you or Brett won't return the phone call and tell them why we won't pay their bills. I don't know why we won't pay them because I can't answer that, but I wish you or Brett or somebody would just call and give them an answer one way or the other. No, we're not going to pay it because of this, or we're working on something, but I can give you those names.
Okay, please do, because
Okay.
I was actually caught up on email yesterday by about 4, so I'm surprised. So,
Well, I have one of the names here, but I'll email them to you.
Good.
And so, it's, they just need to be told, what.
right. Right.
The other thing I brought up, I don't know, a month ago about, I was looking at the numbers for the J Clinic, Sam Howard Clinic in Salina, and the prescription rate at J was about, the numbers of patients were not too far apart, but the prescriptions was almost 1,000 difference in the prescription rate. And it got me wondering why they need the medicine fine, but I'm just wondering why it's like that. I don't know
You
if we
asked
could
me
just-
that last month, sir, and I
Okay.
did not follow up. I apologize.
Well, I'm just curious. I don't
Yeah,
think.
it's a good question. I mean, it's an expense, and so, you know, providers practice different, so
Yeah.
it'll be interesting to take a look
Well,
at
it's just
that.
interesting to me to find out
Yeah,
why
I
it's
would
like
agree.
that. So. Okay, if you check on the road, and I sent you an email this morning about the person you may not have chance to.
I haven't looked at email
Okay,
today.
I'd send it also to the mental health director, so hopefully.
Okay.
Okay, thank you. Thank you, Madam Chair.
Counselor Clinton?
Yes, Connie, I'm just going to go back to what Dick was talking about. I mean, there's certain things I'm finding that the council, it's kind of hands-off, you know, that's not a council thing. You know, as far as implementing what Secretary was talking about, you know, the talk about the raise and the specifics. But we will be asked to either vote on or not vote on the budget. So it just makes perfect sense to me that something as important as what we're talking about come to us before we do the vote. And that's exactly what I'd like to see. I would like to have that to hash on when we're making our decision whether to say yay or nay. That, you know, that may be a big thing to, especially our constituents and, you know, the folks that's going to affect.
It's a big thing to us, you
I know
know.
it is.
We're having to
I
ask
know it
questions,
is.
and it's something we all want. We all agree
I
on
know,
that.
but
And,
I'd like to see it.
We want to make sure that when we put something forward, it's something we can comfortably afford, that really is an effective tool to
Right.
recruit and retain our good doctors. But we don't want to put forward something that we have to take back again next year
Right.
because there's a budget cut or something. So really taking into consideration, you know, is our IHS funding going to stay the same? How's our third-party revenue looking? And we finally feel like that at least is stabilized to some degree. And we feel good about what's being presented, that it'll be effective recruitment tool, which is what we all want. We have vacancy in every clinic, I think, except for Stillwell. And we need this to go forward, and I'm comfortable the chief's office completely supports our proposal, I believe, and just making sure our numbers are right is what we're doing.
Right, it just didn't set good. Well, we're going to vote on this thing, then we'll let you know about it. I'd like to see it beforehand, if that's possible. So you can,
I'll let them know.
thank you.
Counselor Walkingstick, did you have a question?
Yes. Hey, Connie, the IHS talked about funding. Is there going to be any cuts in funding?
That's still an unknown. I was waiting on the president to make that decision.
Have you haven't talked to anybody, or you haven't lobbyists?
We have lobbyists, and there's proposals that we don't know. We just don't know. There's speculation everywhere.
Speculation of Medicaid being cut.
I'm sorry?
Speculation of Medicaid being
Yes.
cut.
Yes. On a good note, I was very busy this morning because we got a call late last week that Secretary Price will be wants to come tour and see our joint venture facility. And this will be a great opportunity. We met with his staffers all this morning and turned around the Jack Brown Treatment Center, because I think that's an IHS-funded facility that's highly successful. And I want them to see that we've been good stewards of our funding. And we have IHS payback students in almost every one of our leadership roles. And we should be the model they want to see throughout the U.S., not a problem for them for funding, that they don't question what we're doing with our money. They see we're taking care of our people, we're putting it into our buildings and delivering high-quality care. So that will be an incredible opportunity to visit directly with him and show him that, and have his ear for about 4.5, 5 hours in September.
When you say take care of our money, sir, I like to see the contracts, the amount of money we spend on CERN for contracts for IT support. Do I need to get that in a FOIA, or?
Yes.
Todd, do I need to do a FOIA on that?
Yes, that would be a FOIA request, and depending on the request, we'll go through it and share it with you in the most appropriate fashion.
Is that a 30-day process? Because I'd like to have these numbers before budget hearing. It's probably not feasible though, being middle of the month.
Send me your request and we'll make every accommodation.
Okay. All right. That's good. Thank you, Tom. And then you also mentioned that we've never terminated a contract in the Cherokee Nation and our health. Is that correct?
That's not exactly what we said.
Okay. What was it you said about?
What are you asking?
So the question was posed that contract, has it been terminated? Has a doctor been terminated from basic?
No, there have been contracts that have not been renewed, but off the cuff, in the middle of a committee, I can't think of any doctor that's been terminated.
What the contract being terminated? I guess so. Okay. It's not being renewed. That's all I have. Thank you, Chair.
Okay, Counselor Warner.
Yes, ma'am. Thank you. Connie, we just got back last week, went to the CDC TAC meeting, Tribal Advisory Committee. In announcements, I'd like to kind of go over some of those things that I learned and some of the things that I think is happening on a federal and national level. But before that, you know, the Chickasaw, we had many presentations given. The Chickasaws give one of those, and one of those was integrated behavioral health. So how have we ever looked into that model or anything like that? I mean, they seem to like do it really well, you know, but I don't know. Can you give us any?
They do that very well, and as a matter of fact, there will be integration of behavioral health into primary care in the new facility here in Tahlequah.
Okay.
So we're excited they will have an office right with the primary care, so they're not so segregated. There will be separate offices, of course, for behavioral health, but a lot of times, you know, during a regular appointment is when the doctor first hears, you know, they're feeling depressed or identifies that. And the sooner we can get the patient access to those services, or they may be in a crisis at that time, having someone there in the clinic that they can just slide on down. Actually, the focus will be bringing services to the patient in the design. Right. And so we're really excited to be able to implement that.
Good. Well, to give everybody an idea of what we're talking about, the patients there, whether it's in, I think they even go as far as even in dental, but once they kind of sense something to the doctor, they call in behavioral health and they start treating that patient, because it's kind of you know, I mean, everything. We see the behavioral health dollars that we need and those things. Well, this kind of helps to funnel it. You know, we have that problem here. We've had those discussions in this very committee about behavioral health and our shortfall, and I think this helps some of that. So I'm excited to hear about that portion of it, because it was something that they were very proud of, and I'll continue the rest of my discussion and announcements. Thank you.
And we're excited that you're serving on that. Congratulations.
Connie, I have a question. You said earlier that in contract health we still have a problem with overspending. How much of that overspending we're doing is on locum tenens and on consultants?
I don't believe contract health dollars are spent on locums contracts.
Can you give me an idea of how much we are spending on locum tenens?
Not off the top of my head. I could certainly get that for you.
I would appreciate that.
I can tell you that we may have one locums contract at the hospital, and then we of course have a couple filling in at Nowata, maybe at Oshaleta. I have to verify what the current status of those are, but I can get you that information pretty readily.
Okay, Connie, I've been informed that we have lost 23 providers in the last 12 months, medical providers. That's not true?
No.
Could you get me a list of those that we have? I would really be grateful on that. And also, tell me, how often do we utilize consultants in our Indian Health Services?
Are you talking like cardiology consultant? Or
any medical consultants? I was just wondering what kind of fees we're paying in consulting.
Consulting fees? I don't think we use a lot. If we're talking about the same manner that I'm thinking.
A medical consultant we bring in to consult and advise us in different areas. I was just wondering how much of our income, or excuse me, our money are we using to hire consultants? And what are we getting as a result of that?
Okay.
Okay? But By the way, I have heard, obviously, from several people, medical providers, and I hope you all know, as well as everyone sitting here, I welcome the phone calls. I want to help, and I would implore you to contact me if you all have any questions, or if I can be of any service in any way. I'd really like to talk about endocrinology just for a second. I see, because it's over and over every month, that the number one health problem and concern we have is diabetes type 2. How many endocrinologists do we employ?
We have a contract with OU for an endocrinologist, then we have a couple of pediatric endocrinologists that come to Hastings.
How often are they there?
I would have to check to get you those exact times.
Okay, and I want to talk to you. I had a person tell me recently that they went to Hastings, they had a broken monitor, and that because they were told to send the monitor to the company for a repair. Now, I don't know, do our monitors log in when you check your blood levels?
Do they log in?
Yeah, I mean, do the monitors keep an ongoing record? I know you can keep a personal
They
log.
keep 30 days, I believe.
Oh, okay. So what happened is they sent their monitor in to be repaired, but they couldn't get their diabetic supplies because they couldn't bring the monitor in to justify their blood levels that they had been experiencing. Can we stop that kind of problem so we don't kill anybody?
Of course, we don't want to kill anybody, but that should not have happened. A replacement monitor could have easily been
We
provided.
do have replacement monitors available for our diabetics.
If you can give me the name of that patient, I'll be glad to follow up and make sure they have a meter now. I mean, I'm diabetic, so I can certainly appreciate the urgency and the need of seeing where your blood sugar is so you can function.
I appreciate you wanting to follow up on that. Thank you so much. And then, I have another question. I was told that we had a possibility of a grant to pay for this new diabetic drug. You probably can tell me more about it than I'm aware of it. Trojeo, and I think the other one was, let's see, where it had the built-in ability to help you also control your appetite to help reduce weight. And it was offered to us by a $6 million grant that we turned it down. Could anyone explain that to me?
This is the first I've heard of it. Dr. Stalker?
Well, I may have been misinformed, but I was told that it went through the Pharmacy and Therapeutics Committee. However, it was not approved at that time, and recently it was brought back to, I guess, Pharmacy and Therapeutic Committee and the Medical Executive Committee, along with another medication, to help obtain control of a rapid diabetic epidemic, and both were approved, yet we have no financial impact on the nation due to the grant program, yet it's not available to the patients. But you're all not aware of this?
No.
Could you all check with the Pharmacy and Therapeutics Committee and get back to that? Because $6 million is a lot of money, and this sounds like a drug that may be able to help our patients.
Well,
I would
obviously,
really,
we would be very interested in that as long as it is, FDA approved and under up-to-date practices, which is the most recent protocols.
I was actually told that it was. And then I have one other question.
What was the name of the med again?
It's, I've got it down as Toujeo, Toujeo.
That's the long insulin that was approved. Let me check into that, ma'am. I don't know if this was part of our diabetic grant that we're currently receiving, that they said we can use a portion of that to pay for the money, so there will be no impact. Let me follow up on that.
I would appreciate that. And if you could.
I don't think there's an additional $6 million, or we would be doing that.
Yeah, we won't walk away from
Okay,
$6 million.
well, good, I'm glad I asked, because I don't want to be misinformed here. And then also, I'd like to request a copy of your policies on document controls and your medical staff bylaws. If you can hard copy that to me, I'd be grateful.
So, does that need to go through a FOIA, Todd? The bylaws and, what were the other policies, ma'am?
Just your document control and your medical staff bylaws.
That will probably be a public document.
Okay.
Ms. Bakershaw, Chairman, if you could send me that request, I will check it against the police.
Okay, I appreciate that.
And I will tell you, most of our policies, we have a lot of policies to meet DMV accreditation, and it's through a link, so it may be that we help you get access to that. Not so much of a hard copy of literally thousands of policies.
Okay, and then Dr. Stalkup, happy anniversary. I think you've been an employee for a year.
He's been here a little longer than that.
Has it been a little longer than that? I was going to ask, is his position permanent, or are we going to advertise for it? Can you update us on the status of his position?
Well, he's doing a great job, and right now he is in an interim position, and we've been just busy. We haven't discussed it further, to be quite honest. We're making progress rapidly and moving right along, so he's meeting our expectations. He's exceeding our expectations.
Well, if he's exceeding, do we advertise and those conditions? I don't know. I'm
It has
asking.
not been advertised. He's kind of wearing two hats, so right now he's managed incredibly well, and there are no plans to advertise that I'm aware of.
Okay. I was just wondering what the policies in hiring were in positions of executive leadership. Does anyone know?
If they don't know, we don't know.
I could get back to you and see.
Okay. That's an HR question? Okay,
Yeah.
thank you. I appreciate that. Thank you.
Stephanie Wycliffe, is that correct? HR?
No, she's, no, we'll talk to Nathan about that.
Okay.
And Dr. Stalkup, I also want to share, I spoke with a very, very fine young man yesterday, Stephen Carey. He was so kind to me yesterday, and I just wanted to pass that on. He helped me understand the RVUs a whole lot better, and I feel much better after having talked to him, and I hope you pass that on. Are there any other questions or comments for us?
I just have a comment.
I do have you didn't ask me, Councilman Lay, but you had asked George about the IHS event, but it's a National Indian Health Board is hosting a behavioral health summit at the Hard Rock. And as a matter of fact, Secretary will be doing the opening again tomorrow.
I was wondering if we had some.
Oh, yes. Joni, Mark, we've got several going.
Thank you.
Just a comment. Good news on the behavioral health. Dr. Jones, just want to commend you and your staff there and down there at Hastings. I was there a few days ago. The morale, from the employees from one to another, they were covering each other. The waiting was not very long at all. You guys, from when you took over a few years ago and where it is now, you've really come a long way. So, you and your staff, let them know that we appreciate what they do. Good job. Thank you, Madam Chair.
Will there be any other questions? Then the meeting stands adjourned. Oh,